Howdy, Dr. Leibert here. Today's study will be on the urinalysis. To pee or not to pee? That's the question. Something of a fruity bouquet. Maple syrup urine, perhaps? Never know. Well, like in all things that we've been doing, you need to have a systematic way of looking at the urinalysis. I prefer the 4 C's: the cells, the casts, the crystals, and the crud. So let's start right off. Within the urinalysis, one of the most common findings, what we call a contaminated sample, if you will. If you see lots of squamous cells, there they are, those big pancake cells with the small pycnotic nuclei. 1 or 2 of those per high-powered field, not a problem. But sheets of those in a urinalysis, it's a contaminated specimen. You need to either cath the patient or get what we call a true clean catch. They urinate the first few drops, first little stream, and then catch them midstream. That way the epithelial cells, these epithelial squamous cells, are washed away so that you get what's truly inside the bladder. So you don't want a lot of these epithelial cells. Now here's a real-life epithelial cell within the urine, that big pancake with that small pycnotic nucleus. Now, there's some other cells that you will see occasionally in the urine. The renal tubular cells are cells that line the collecting system, and the ureter. They are about twice the size of a white cell. And then you have the transitional cells. These are pear-shaped cells that line the bladder. They're twice the size of the renal tubular cells, and about half the size of an epithelial cell. Renal tubular cells and transitional cells. Again, you'll occasionally see these in the normal urine. 1 or 2 of those, not a big deal. But if you see lots of renal tubular cells, you've got to worry. Is the patient having acute tubular necrosis from medicine, from dehydration? Is something happening to that kidney? Or does the bladder have so much inflammation that you have nothing but sheets of transitional cells? A few, fine. A bunch of those, there's an abnormality. You need to know what's going on. Let's talk about the white cells and the red cells. Now here's the white blood cells. You notice that they have granules in the cytoplasm. And there's the red cell, no granules, about half the size of the white cell. The red cell is something of a donut. It's a biconcave disc, and you're cutting it in half. So the center often has a little donut hole in it. Here's another picture of all sheets of white cells. See all the cytoplasmic granules, the PMNs. The smaller cells are a little dried up red blood cells, so be careful. If this is an old, dry looking slide that's been sitting under your microscope, it'll dry out and the red cells will be crenated and have this chewed up appearance, and you might mistakenly call those white blood cells. Boy, here's some nice white blood cells in a true life spin down. And you see the white blood cells, we would say too numerous to count. This is a high powered field, and those white cells are everywhere. This patient has a urinary tract infection, maybe a pyelonephritis. Here's some nice red blood cells. Again, notice that they are like little donuts. About a third of them are like a little donut hole. And then that birefringent or double thick edge, because you're looking at a biconcave disc in 2 dimensions. Those are nice red blood cells. Now, if you have a patient with post-strep glomerulonephritis, they'll have red blood cell casts. Those are red blood cells within a plaster of Paris cast of the renal tubule. It's called a TAM horsefall protein. And that collagenous protein collects those red cells and makes a cast of the renal tubule. That's always abnormal, and that's typically seen in a glomerulonephritis. The most common you'll see is a post-infectious, post-viral, or a post-strep glomerulonephritis, the red blood cell cast. Now here's a white blood cell cast. Same idea, but this isn't a patient with pyelonephritis. There's white blood cells all mashed in those tubules. They get surrounded by protein, making a plaster Paris cast of that tubule called a white blood cell cast. Again, that's not a normal finding. Here's a granular cast. You'll see this in acute tubular necrosis, secondary to rhabdomyolysis, maybe pre-renal azotemia, a patient with heart failure, a patient that's been dehydrated, a heat injury patient. And because there's injury to the kidney itself, there's this sweating of granules and breakdown products that get caught in that proteinaceous cast. This is called a granular cast. On occasion, you may see one of those in a totally normal person. But when you see granular casts, bunches of granular casts, that's bad news. That's suggestive of a renal failure sediment, some sort of acute tubular necrosis that's ongoing. Now the crystals. We looked at the cells, we looked at the casts. Here are the crystals. These are calcium oxalate crystals. They're called envelopes. You'll see this in renal stones. This is the most common cause of renal stones, the calcium oxalate crystals. Not uncommon in patients that get dehydrated and develop stones. There's other causes of stones. Of course, uric acid crystals, which are very spiculated crystals, triple phosphate stones, which are called coffin lids. But these are the most common, calcium oxalate crystals. Now, the crud, the last C. These are amorphous urates, just breakdown products, if you will, that occur within the bladder wall, particularly in patients with dehydration. If you spin this down, you'll see what's called a brick dust, sort of a pink dust that sits at the bottom of the spun down urine. Amorphous urates, breakdown products of the nitrogenous wastes that collect in the bladder, particularly in someone who's dehydrated, is not getting good flushing of the bladder with good fluids. You can also see mucus threads and other spores, sometimes fungus, particularly a diabetic patient may have candida vaginitis or balanitis. So we've talked about the 4 C's of the urinalysis. We've talked about those cells, renal tubular cells, transitional cells, squamous cells, the white cells and the red cells, the casts, particularly red cell cast, white cell cast, granular cast, and the crud like amorphous urates. So spin those urines, take a good look. They can tell you quite a story. Have a good day. Oh, that's good. That is tasty. See you next time.